information.
Well, thanks so much for that, Olivia, and it's so nice to be back with you all. Thanks for tuning in. I know that this has been a long road with us being over a year into things now. The exciting thing of the last 6 months has, of course, been the vaccines, and I hope you can see my slides now because I'd love to talk to you a little bit more about the vaccines. People are nodding, so I'm going to go ahead. So we'll just do a brief overview of where we are with these vaccines. And then, please unmute yourself, interrupt me, drop a question in the chat if things come up. But we'll also try and get to a discussion at the end. I put this together 3 days ago. There's already been a couple of changes. So these things are still changing very quickly. And so have patience with me if there's new things in the last couple of days. So just generally, the messages with these vaccines are that these vaccines are effective. They're actually much more effective than I had hoped when we were last summer and last fall, when we were hoping that we would have a vaccine soon. They're also safe. So really now tens of millions of people in the United States have had these vaccines. There's been intense safety monitoring, several levels of safety monitoring beyond what we've had with vaccines in the past. And of course, more people have gotten these vaccines than many other vaccines in a very short period of time. So we're glad that we now have enormous amounts of data to be able to back up the statement that these vaccines are safe. And then of course they provide not just individual but community protection. So not only will you getting a vaccine protect you from hospitalization and death due to COVID-19, but it will help you end the pandemic. So if we get enough Alaskans immunized against COVID-19, then we can really be able to, this is our path to going back to living life like before COVID-19. This is really the solution. And I'm very glad, that's why I'm very glad to be able to talk with you about vaccines today. Going on to, who is eligible, Alaskans or anybody who is here. So living and working in Alaska, you don't have to be an Alaska resident. Is free to make an appointment, and these appointments are widely available. There are 3 vaccines. Pfizer we're currently able to offer for ages 12 and older, and the others we're able to offer for ages 18 and older. One of the other companies, so Moderna, is in the process of getting theirs authorized for ages 12 and older, but we don't have that one yet. For 12 and older, it's 18 and older right now. So anybody who's here really can go ahead and sign up now if they're 12 and older. So just to touch on this a little bit more, no safety steps were skipped when these vaccines were developed. They really built on decades of research, and some of our research using mRNA cancer vaccines, and a lot of science went into that. So really, this would, through the same amount of safety checks that any vaccine and any medicine would. So in, the phase 3 trials, so phase 1, companies will check in a small number of people. Phase 2, they'll check in hundreds of people to make sure that things are safe, and then also check if they work. And then phase 3 was really the trials back in July, August, September, when thousands and thousands, so tens of thousands, 40,000 people in each of the mRNA trials, and even more than that in the Johnson & Johnson trials, received this vaccine to check for safety, but also to be able to know exactly how well it worked. And so all of us were very pleased to see how effective they are as well. But this is the same safety process that vaccines go through. And then of course, once the FDA authorizes or approves a vaccine, the FDA keeps monitoring it for as long as it's on the market. And that's true for all vaccines, not just these ones, but the FDA is continuing to check on the millions of people who've gotten these vaccines, and they take reports about anything that has happened, whether or not it has anything to do with the vaccine. They investigate those. So people will ask me, how did this happen so fast? How did we go from, learning about a virus in December, knowing the sequence in January, to now a year later having almost half of Alaskans with their first dose of the vaccine? So really what happened here in the US was we cut red tape and bureaucracy. So that was the really big difference between, the normal vaccine approval process that takes typically a lot of money, but also many years. And a lot of that is that this is an expensive process to go through. What we did instead is much, 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 much more money than usual was poured into this all at once. And some of the bureaucracy was really, streamlined. The FDA would answer phone calls the same day instead of, waiting a month to return an email, that sort of thing. That might be a little bit of an exaggeration. I don't want to disrespect them, but that's really, part of the story. We certainly weren't starting from scratch when we started with these vaccines. This mRNA technology had been developed exactly for being able to respond to a pandemic. And then, of course, a lot of money went into this. A lot of people volunteered for clinical trials. You'll hear my daughter in the background. And so, instead of spending a year recruiting volunteers for a vaccine trial, there was an outpouring of support. And many, many, many people registered for these trials, and the companies didn't have to spend more than a week or two really getting volunteer lists together. And then, of course, the United States started manufacturing very early in this process. Typically, when you have a vaccine developed, you wait until it's completely approved for the commercial market, and then you start manufacturing. Manufacturing is complex, and it takes a long time to be able to scale up to mass production, and it's very expensive. So companies typically don't take that risk. But the US government and other governments partnered to take that financial risk and pour massive amounts of money manufacturing vaccines that they didn't know would work yet. So if these vaccines hadn't been as safe and effective as they are, we would have, lost that money. But fortunately, that really paid off. And so once the vaccines, once it was proven that they were safe and effective, we were able to start distributing instead of waiting 6 months or a year to get those mass production lines up and running. So I think that's one of the stories about how these vaccines are with us so soon. And then, of course, just a little bit more about, the ongoing safety monitoring. So there's a number of systems that are in place for any vaccine that's on the market at any time. So the CDC has a website where anybody who's had a vaccine or any nurse or doctor who's given a vaccine can report any side effect. And so the CDC investigates those. But for these vaccines, because we're giving them to so many people, and because this is, a huge national effort, the CDC has also launched another app, so the VSafe after vaccination health checker. And so I did this after my vaccines. It's actually kind of neat. You scan a QR code, and then the CDC sends you a link that checks on you, in the first few days after your vaccination, and then every few weeks afterwards. I think I got a 6 or 8 or 10 week out message the other day. I don't remember how long ago it was now for me, but the CDC will check on you. And of course, if you're having any problems, you can let them know. Of course, most people have either no side effects at all from this vaccine, or will have a little bit of pain or muscle soreness where they get the shot. That's the typical effect. And you're welcome to tell CDC about that. But they're mainly doing it to pick up anything unexpected. And so anytime they pick up anything unexpected, that's something that the CDC investigates as well. So fortunately, we know that these systems are in place, and they keep monitoring the safety of any vaccine as long as the vaccine is available. So there's a fair amount of coverage about allergic reactions. So these are very rare reactions with these vaccines, and they're also treatable. So currently we're estimating maybe 5 in a million people will have an allergic reaction with these vaccines, like a severe allergic reaction. Another name is anaphylaxis. And so really we're doing a few things to make sure that this doesn't affect anybody long term. So one is we want you to know what's in these vaccines. If you have anaphylaxis, so a severe allergy to one of the ingredients in these vaccines, in the mRNA vaccines, then we ask you to get the Johnson & Johnson vaccine. So the mRNA vaccines have salt, sugar, water, mRNA, which we already have in every cell in our bodies, and then lipids, which is another word for fats. One of the fats that they use has a common medicine ingredient called polyethylene glycol. But this is something that occasionally, very rarely, people are allergic to. So if in the past you've had a severe allergy to polyethylene glycol, or another thing that's similar to it, polysorbate, and polysorbate is in all kinds of foods. If you check, the back of your ice cream, you'll probably find polysorbate in it. But if you've had a severe allergy to these, then CDC says, maybe you shouldn't get the vaccine. You should get the Johnson & Johnson vaccine instead, because it doesn't have these things in it. We haven't seen allergic reactions with the Johnson & Johnson. This one's really just the mRNA vaccines, the ones made by Pfizer and Moderna. So that's one part of it. So if we know that you're allergic to an ingredient in the vaccine, then we'll have you get another one. However, those allergies are super rare. And so what we do for everybody else, including if you've had a severe reaction to something else, if you've had anaphylaxis to something else, you can still get these vaccines. What we do is anywhere anybody is getting these vaccines, there's somebody with epinephrine. Epinephrine is the antidote for this, and it's something that can fix an allergic reaction very quickly. So people who, even though people have had allergic reactions with these vaccines, rarely, they've actually been fine because they've been able to get that antidote right away. So we make sure that you're there and that there's somebody to give you that medicine if you're one of those rare people that this happens to. Going along with that, we ask everybody to wait at least 15 minutes afterwards because usually, if the reaction is going to happen, it happens right away. But if you've had anaphylaxis in the past, so if you've had a severe allergic reaction to something else in the past, you can still get these vaccines. We just ask you to wait 30 minutes to make sure that, we're catching any allergic reaction. But, and I'm happy to answer more questions about that. That's a very common question I get because so many of us are allergic to pollen and so on here, and you can still get these vaccines if you have other allergies. And then general side effects, I think I touched on this. Many people have pain when they get any kind of shot, or redness and swelling when they have any kind of shot. Some people, not many, but some people will feel tired or have a headache or have chills or even a fever or nausea after getting these vaccines. But this goes away within 1 to 2 days. And some folks will take medicine afterwards if they have these side effects. The one thing I want to warn you about is to not take medicine beforehand to prevent the side effects. Because remember, these side effects are your immune system building immunity to it. So it's okay if you take Tylenol after you get the shot and your arm's hurting, but if you take it beforehand, it might not give your immune system a fair shot at building that full immunity. So you can take your regular medicines, but don't take extra new medicines that you don't take every day beforehand. And again, many people don't have side effects at all, and it doesn't mean you're not building immunity. Going on, so, one of the ways that we think about how to protect yourself from COVID, and I think this slide is starting to get outdated. Before we had the vaccine available, really being able to wash your hands, distance, wear a mask, were our best ways to protect against COVID. And you really needed sort of all of those to align to be able to make sure that you weren't going to get the virus. But now, once we know now that once you're 2 weeks out from your second shot, you have very, very high protection against COVID-19. So for that reason, in the last few weeks, even the Centers for Disease Control have changed some of the recommendations. So there's still, many places where folks who are fully vaccinated will still need to wear a mask, for example, on airplanes or in healthcare settings. But if you're visiting family, if you're visiting friends, and everybody's fully vaccinated, so 2 weeks after their second shot or their only shot, if it's Johnson & Johnson, then that's a situation that's safe enough that we can really put these things behind us. So that's sort of a testimony to how well these work. And so, of course, when you're fully vaccinated, this is where we kind of get at that. So other than those settings where everybody has to wear a mask no matter what, like transportation, healthcare, fully vaccinated people can really, kind of start to go back to how things were before the pandemic. So that's I think that's been good news for many of us. We do have some other benefits other than not needing to mask around other fully vaccinated folks. So, this vaccine really does prevent cases, hospitalizations, and deaths. Essentially, very close to all deaths from COVID-19 in one study were in unvaccinated people. So that was in Cleveland. We're seeing similar things here. So the folks that we currently are seeing hospitalized or dying from COVID-19 here in Alaska, these are folks who were not yet able to get their vaccination. So that's one of the reasons we'd really encourage everybody to go ahead and get this as soon as we can. And then, of course, we're thinking about long-term side effects of COVID. We're starting to hear more and more about them. Certainly more people are experiencing longer side effects, even folks who had very mild illness, including some people who had no symptoms at all when they had COVID. So we're hoping that these vaccines prevent a lot of cases of long COVID in the long term. Of course, COVID-19 can have severe problems in children as well. Fortunately, many children don't get too sick, but some of them do. And healthy children as well as children who have other health conditions. So, as we're able to vaccinate younger children, 12 and up now, that's something that we'd really encourage to try and prevent these severe complications in children. And then, of course, I hope everybody knows this, but if you are fully vaccinated, you no longer need to quarantine if you're exposed to COVID-19. And of course, vaccination is free, so it's no cost to you. And so people shouldn't be charging you to get a vaccine. So some people will ask me about pregnancy and lactation. Some of you might have seen I think there was a picture of me getting my vaccine because I'm currently breastfeeding my daughter. And so I was following this very closely. And, there's starting to be really good data that there's a fair amount of antibodies in breast milk and antibodies that pass through the placenta to babies for folks who are able to get vaccinated while they're pregnant or while they're lactating. So more than 100,000 pregnant women in the United States have been vaccinated so far. When these vaccines first came out, we weren't able to look at lots and lots and lots of people in the clinical trials for pregnancy because the clinical trials tried not to include anybody who was pregnant. A few people became pregnant during the clinical trials, even though they were asked to use, a few forms of birth control. So we know that there's no problem with fertility. But we didn't have that evidence now. Now that we have more than 100,000 pregnant women in the United States who have been vaccinated against COVID-19, who have been registered for safety monitoring, and no concerns have been found with those pregnancies or those babies because of the vaccine, I think that lends a lot of confidence to the safety of these vaccines in pregnant and lactating women. So currently for folks who are pregnant, or who are trying to become pregnant or who are breastfeeding, they may choose to get a COVID-19 vaccine. And then of course, just another reminder, because there are some folks who aren't able to vaccinate, and so currently that's kids under age 12, being able to surround kids under age 12. So, folks working in childcare, especially, and the families of young kids. Both my husband and I are vaccinated, and we're hoping that that helps protect our daughter who's too young to be vaccinated. We're hoping that, if we get everybody who can be vaccinated now, that'll be able to really help protect the kids who can't get vaccinated yet. So we have a vaccine helpline. We have a folks who can help make appointments. And then there's also a website at covidvax.alaska.gov where you can find vaccines available in your community. So I'm happy to take any questions that you have.
Great, thank you so much, Dr. Ohlsen. We don't have any questions in the chat box at the moment, but we could just open it up. Maybe if anyone has any questions right now, just go ahead and take yourself off of mute and ask away.
Hi,
I have a question. Go ahead.
Go ahead, Jazanne.
Oh, okay. So this isn't exactly COVID, but what you said makes me think about it. So are you saying that people take prophylactic painkillers that can reduce the effectiveness of a vaccine in general?
Yeah,
Okay.
so there's some evidence that taking Tylenol or some other medicines that can slightly dampen the immune system. Steroids would be one example of a medicine that would really dampen the immune system. There's a small amount of evidence that Tylenol might dampen it a little bit. So we recommend not taking that unless it's a medicine you take every day.
Okay, so when you say Tylenol, are you using that generically? So like ibuprofen would be okay and not acetaminophen? Or are you saying all of them?
So we'd recommend, so not acetaminophen, which is also known as Tylenol, not ibuprofen, not allergy medicines, not steroids, not anything else that's designed to, we wouldn't recommend you take any extra over-the-counter medicines or any extra prescription medicines beforehand, unless they're the medicines you already take.
All right, thank you.
That was a great question, Jazanne. Thank you so much for asking. I saw someone else jumped off a mute. Whoever has the next question, go ahead and jump on.
Hi, I'm Nora. I have a question. So I have kids now that are at the house from school, and now it's summertime and they do wear their mask when we're inside, but when we go out to the park, is it okay for them not to have the mask on? Because other kids are teasing them.
Yeah, so for kids who aren't vaccinated yet, they're all in the same household, then that's kind of one thing. If they're from different households, that's another. So for anybody who's not vaccinated yet, we're still saying it would be a good idea to wear a mask around other people. Indoors is a lot more, it's a lot more important to wear a mask indoors than it is outdoors. If kids are playing pretty far apart, or if they're running really hard, then it's not as, it's not as necessary. But if kids are playing really closely together, they're not playing, active sports where they're running around. It's a good idea if they can keep it on. But the most important thing is really going to be when they're indoors.
Can I ask a follow-up mask question, just since we're on that? That was a really great question. So Dr. Ohlsen, we've been getting some questions at Thread from programs, about masking because young children in care, are not eligible for the vaccine. So some have asked if the teachers are vaccinated, is it, do you recommend that it's okay that they're not masked, even though, the young children may still be, Or should they do that for modeling? You know, we've been getting just some questions, and it almost talks to your community immunity slide. But I think, you know, because most of these people are around young children all day, you know, I think they're not really sure how that impacts them and their business.
Sure. So so these are very powerful vaccines. They're very effective. They're good protection. They're not perfect, but they're very, very good. If I were taking a group of children bicycling and I told them that they had to wear helmets and I didn't, that can be a tricky concept, especially for younger kids. I think for modeling alone, being able to show a kid how to wear a mask and that, you know, this is when we wear a mask, this is, you know, how we take them off when we're going to eat, and then this is how we put them back on again. That's just, it's so nice to be able to, you know, work with children like that and be able to model these things as much as we can. You know, understanding that every facility is going to have a different policy around this, I think it probably does make sense for modeling alone to wear those around kids. And then of course, you know, these vaccines are 95-96% effective against any sort of COVID. They're very, very, very effective for keeping you out of the hospital, keeping you from getting really sick. There still is a small chance that you'd pick up COVID and be able to give it to somebody else. It's just a very small chance, and it's unlikely that you will get very sick, of course. So really great vaccines. But I think, you know, when you're working around kids, especially with that modeling component, it might be nice to consider continuing to wear a mask in that setting, indoors especially.
That was a good question, Stephanie. I don't know if that's the answer that we wanted to hear, but but it's a true valid response to the risk that children still have. And I think the vaccine manufacturers, this is their goal, right, is to try and get to the next age group so that we can test the vaccine and make sure that it's safe and effective for all age ranges.
Yeah, and you know, they're doing those trials right now. I have some friends in Atlanta who their infants are in these trials, and there's actually there's a number of folks, kids of epidemiologists who are trying to get in these trials, and there's such a long waiting list that they may not be able to get in. But we're hoping that we're going to see vaccines for much younger children available in, you know, as early as this fall. The nice thing is vaccines are the same in adults and most kids. It's not like you have to make a totally different vaccine because remember, a vaccine isn't like a medicine. It's not something that you have to dose a certain way for how big you are. Instead, it's really just showing your immune system a snapshot. So it's not like we give, you know, a huge dose to an adult and a small dose to a kid like we would with Tylenol. Instead, we just really use a tiny bit of vaccine for everybody. We don't want to, you know, use a bigger bit because then manufacturing's harder. We want to use the smallest amount we possibly can to trigger a memory of the immune system. And then, you know, vaccines only stay in the body for a day, maybe 2 at the most. So, you know, it's not like these things are hanging around or building up. For that reason, our vaccines in adults and kids are usually the same. And we're expecting to be able to give the same vaccines to younger kids as we are to 12 and up right now.
That is very good news, Dr. Ohlsen. Again, great question, Stephanie. Any other questions from the group? Any burning questions? I will say that I was one of the first people, I think, to receive a vaccine in the state of Alaska because I'm a frontline healthcare worker. And I got the Pfizer vaccine because that was what came out first. And the first dose, I would say I didn't even feel it. And then the second dose, I had very minimal side effects and they went away really, really quickly. And honestly, I don't know if it was because I was skate skiing that I felt hot or if it was because of the vaccine. So That's kind of my story. And I have vaccinated a lot of people in the community of Valdez and seen minimal side effects at vaccination sites. So we did give Benadryl a few times, but no EpiPens or anything like that. So it's been fairly uneventful, which is what we hope for when we're doing a vaccination clinic. So.
Olivia, I was thinking about that. I had really psyched myself up for some side effects, especially since they tend, on paper, older folks tend to not have any side effects at all, and younger folks tend to have a few more side effects. The thinking is that maybe your immune system is a little bit more robust. So I was sort of like, okay, I'm going to have, a fever or whatever. I didn't feel anything with either shot. I just have to tell you. So, a lot of folks don't have any side effects at all with these vaccines.
And that's Dr. Ohlsen's way of saying to everyone that I'm old. Just kidding.
I think we're the same age. Are we the same age?
Who knows? I'm only kidding. You know that, Dr. Ohlsen. But definitely want to open it up to the rest of the group. Are there any other questions for Dr. Ohlsen or myself, or about COVID vaccination or anything COVID related, I guess,
I had the Moderna, and the first shot was wonderful, no problems or nothing. The second shot did put me knocked out. I had to close my daycare for 5 days. I was really out of it. And my arm was like this big red. So yeah, that's what happened to me. But I already got my shot and I'm good. Just wanted to let you know. That was my experience with the shot, the Moderna shot.
Yeah, thank you for sharing that, Nora, because I think it's important to keep that in mind when you do get vaccinated, that you could potentially have, bigger side effects than anyone else, right? Wouldn't you agree with that, Dr. Ohlsen? Just don't know.
Yeah, certainly. So, I think we're hearing that pretty commonly, especially the arm swelling up, getting red. It does always go away on its own within a week or two, usually within a few days. But that's, it's not everybody, but it's also not super unusual. And so some people will have side effects. I think the good news is that this is your immune system building immunity, and that these go away on their own.
Yes. Go ahead, Stephanie.
I have another question, but I'm not trying to steal the floor, so I hope others will chime in. Dr. Ohlsen, I'm wondering what guidance or advice you can give for childcare programs. They're all small businesses, and some people with us tonight are owners or administrators. They're leaders having to make decisions for their staff and safety and health and safety of the entire program and people in care. What advice do you have for, how to encourage the vaccine? I know many employers are not requiring the vaccine. So, how are you advising small businesses to make really business decisions about how to support their staff with resources, information, where to kind of point them to the great information you shared tonight about some kind of questions or myth busting, so what advice do you have? I mean, this is a tricky situation for some people in terms of like HR and business decisions.
Sure. So this is a really tricky thing, especially since every business knows going into this that the difference between an employee getting a vaccine and not getting a vaccine is the difference between that employee needing to quarantine or not, or that employee needing to miss 10 days because they're on isolation or not. So these are huge, huge economic impacts for every single small business. And so I definitely feel for you, realizing that whether or not you can support your employees to get this vaccine may have huge impacts on your bottom line. So, there are businesses that will give employees a half day off paid to get the vaccine. There are businesses that will guarantee, a day or two off if they have side effects. There are businesses that will, have, other incentives. But I think that the most natural incentives are things like making sure that every employee is also aware that they don't have to quarantine if they get the vaccine, that it's very unlikely that they'll have to isolate or have an ER visit or have a hospital visit or something else that's really expensive if they get this free vaccine, that they know where to get it. So one of the things that we're hearing is that, I'm planning to do it, but I haven't been able to do it yet, or I haven't had time to do it yet, or I haven't gotten around to it. And I think that that really speaks to how busy people's lives are. And there's many places in Alaska where you really have to, you have to drive places. And so if transportation is challenging for people, then that can also be really tricky. Some people may not know that at this point there is vaccine widely available for anyone 12 and up in pretty much every community in Alaska. And it's easy to just not know that. There's stuff on the radio and in the newspaper, but it's not everywhere. And so helping your employees know, exactly where is the closest vaccine, appointments to your place. Can you hand your employees a piece of paper that says, here's where you can go to get this vaccine, and I'm giving you a half day off for it, for example, or whatever your company chooses to do, but just trying to figure out how to make it easy for people. If folks are having, if folks are sort of trying to decide whether they're going to get the vaccine, the most powerful thing for people is to hear from somebody who's had the vaccine that they know and trust. So if you can say, I got it in this arm, and here's what I felt, and here's why I got it, and here's how I feel afterwards. That's the most powerful thing. Folks like me at the state, we're always available to answer questions. If somebody asks you a question and you're like, I never heard of that, I don't know, then go ahead and email and we'll get that answered for you, because we want people to get their questions answered before they get this vaccine. And it's totally normal to have questions. But you can ask folks, you can say, what are you most worried about? If they're worried that it's going to hurt. Some people want to know about needle size. They may not know that we use tiny, tiny needles for this vaccine. You can share with them your experience. And then if you have questions, just, get in touch with us. This is what we're here for. I'll drop a couple of links here in the chat. And I also want everybody to know that there's a number you can text. So you can text your zip code to this CDC number and it'll text you the 3 closest vaccine sites. So that's another good way to make sure that folks know where to get it and when to get it. But please don't hesitate to reach out to with questions.
I had a question. I work at a private preschool and our classes are only 2.5 hours. We did not operate this year due to not having enough staff if people needed to quarantine and staff needing to stay home with their own children. When we opened up in the fall, a big question has come up. We do offer a snack, and now there's questions on whether we should even be offering snack, if kids are taking off their masks, and how we should, if that's something we should do or just cut out totally.
So this is a really good question. And one thing that I think about is I think about schools, because schools have been doing this, right? And you can't have kids sitting for 8 hours at school without having a break to eat. So what schools have done, so outdoors anytime it's possible. Outdoors is always safer than indoors. When we're indoors, we try and get as much space as possible. CDC actually has a little bit of guidance here on how to think about cafeterias, how to think about schools. This is really focused towards a big school operation rather than a small daycare. And honestly, the text here is a little bit dense, but really, the more air, the better, the more distant, the better. Hand washing's always a good idea. So if kids are going to have their masks off, make sure that they're pretty far apart, and then, finding ways to have good ventilation, ideally outdoors. That's really going to help you. I see in the chat, if folks have been doing this, if you've been offering meals and snacks, go ahead and share how you're doing it.
Thank you for that.
Yeah, that was a really great question, Stephanie. And Dr. Ohlsen did drop a couple resources into the chat box from the CDC, if you want to check that out. But yeah, are most of you serving snacks at school? Can you share, please?
Hi, my name is Elizabeth. I'm here from the FNA Early Head Start, and I work in the infant classroom. And one of the things that is very helpful to keep them apart is the tables that have the trays. So it's very easy to have one teacher on this side giving two babies, that are sitting apart, their food, and another two over here. So that's very helpful, but it works wonderful with infants. I'm not sure how that's going to work with older little ones. But it's an idea, and I think also like just sitting down, maybe on mats, just spread apart. A lot of kids are really good at eating and sitting down and eating. We have a lot of great little ones that are good eaters, and so maybe that might help. But again, for the infants, I would highly recommend those tables with the trays. They're wonderful right now.
Great. Thank you so much, Lisbeth, for sharing that. That's a really great point, the physical distancing of people. You'll notice it in restaurants too. It's a really powerful way to it's like a physical reminder to kids, stay apart from each other. Are any other folks doing anything different or have any other suggestions for Stephanie?
Hi, I run my daycare from my house, and I have 3 tables, and my tables have like 2 chairs, and so I took 2 chairs out so 4 people can sit. But yes, I do give them snack and I do give them lunch, and after lunch I change their mask because it's too long to have the child with the same mask on for 8 hours. So after they eat lunch, I do change their mask. Yeah. And for napping, I had my specialist the other day at my house. For napping, that they can nap but with no mask on, but they are apart.
That's a really good
So
point.
yes, I do
Nobody
give
should be
them lunch
napping with a
and
mask on.
snacks, and I change their mask. That's what I learned from the school. Since my son is in school, I learned a lot from them, and they learned a lot from me, and that's how I learned how to work in my facility.
Yeah, those are really good points, Nora. And changing the mask out, mask hygiene, as you mentioned, is super important because that is just it's a big layer when it gets contaminated and it's right over their breathing. You could get some higher risk for, any kind of infection, not just COVID-19. So that's a really great point about mask hygiene. Anyone else doing lunch services that has any good feedback? Jen, I keep thinking that there's a bear that's about to attack you. I honestly did think that. I don't know if you can see Jen's picture, but like behind her, there is actually a bear, and I thought she was outside. So I was like, oh, Jen, get out of there.
That was from last year at the Arctic Circle. That's just my background.
It's kind of conveniently placed there, so thanks for the laugh. But kind of the scare at first, so I'm glad you're okay. So does anyone else want to share if they have lunch service? Otherwise, I kind of want to ask you folks what you're seeing in your early learning centers. do you have other employees that work with you? Are they hesitant to get vaccinated? Are they getting vaccinated? What are you seeing like overall from your population of caregivers that are working with you?
So, for the most part, a lot of people are getting vaccinated in our program. There are a few that are hesitant. I was wondering about why one of them was something about uh, fertility. And, I'm glad that the doctor touched that because I was wondering, I hadn't heard about that. But, I thought this was good information that might be helpful to her. But I think health, more than anything, health issues are a main concern, because there's so many different types of health problems that people may have that they don't know how the vaccine might react to that. I'm also glad to finally hear what's in the vaccine because that's also something that a lot of people are wondering. What's in the vaccine? What are they introducing into their bodies? So I see that this is recorded. Is there a way that we can share this recording with our coworkers and peers?
I'm going to say yes, that we will have this link posted somewhere. And I also think Dr. Ohlsen, the state of Alaska has several folks just like you that are can replicate this exact presentation if needed. So that's also an option.
Yeah.
Sorry to throw you out there.
No, not at all. So we have a team here at the state that can come and talk to groups of people. So please just let us know. We also have a lot of information on our website. Our website is currently down, but we have, some frequently asked questions saying, especially addressing the concern that some people have had that it might affect their health. So fortunately, we know that there isn't a connection between these vaccines and infertility. We haven't seen anything like that. Of course, people in the trials got pregnant and we've now had over 100,000 women not just get these vaccines here in the United States while pregnant, but also register for vaccine safety monitoring. So that means that there's probably quite a few who didn't register for monitoring as well, but we haven't had problems with those. So for folks who are interested in getting pregnant, these vaccines shouldn't affect that. Here on one of the links that I shared, the first one is a link to the CDC's page on myths and facts about these vaccines, and it addresses that too. I want to put the vaccine ingredients here in the chat because I think it's good to know. It's just as a refresher, it's salts, sugar, mRNA, and then lipids, which are fats and water. So these are, other than the types of fats, so the polyethylene glycol that's used in many, many, many other medicines, including, let's see, I think Miralax. The other things are things that we already have in our bodies. A lot of people also have asked me questions about, I have this condition, is it okay for me to get the vaccine? With the mRNA vaccines, they're the only contraindication. So the only folks who can't get these vaccines, there's really two medical situations. One medical situation is if you have an allergy to something in the vaccine. I'm going to write down the polyethylene glycol and polysorbate, because those are the two things that folks have had allergies to in these vaccines. So if you're allergic to one of those things, then that would be a reason why you don't get the mRNA vaccine, you get the Johnson & Johnson instead. The other reason you shouldn't get any of these vaccines is if you just had COVID and you got a monoclonal antibody. And it's not because that's a problem. It's not because it would cause a problem in your body. It's just the way the monoclonal antibody works could interfere with the vaccine and not make it work as well. because a monoclonal antibody, which is a type of treatment for COVID in folks who might get really sick with COVID, if you get the monoclonal antibody, then we say wait 90 days to make sure it's out of your system and then get your vaccine. So you get the full protection from the vaccine. But there isn't any problem in your body if you get it too early. It's just it might not work as well. So those are really the two medical situations where we would say you can't get a certain kind of these vaccines, or you can't get the vaccines at all right now. For people in either of those situations, they still can be vaccinated. So folks who are allergic to the mRNA vaccines can still get Johnson & Johnson. And then folks who have had that monoclonal antibody, they just need to wait 3 months and then they can go ahead and get it. So there's a vaccine for everybody, regardless of your medical situation, as long as you're over age 12.
Woohoo, that's great news. And I think, as Dr. Ohlsen said, it's going to start impacting younger and younger populations. Okay, so Stephanie had a question. If people don't have a doctor that they can talk to, can we give numbers to people so that they can speak to a physician when they have questions? Just because I find this session to be really powerful, where I can ask you directly questions and then you can explain things and you can tell whether I understand them or not. So, and then I can ask you to clarify. So I just really appreciate this platform of being able to communicate directly with the physician. And I think that that would be very beneficial for others. So if you could post in the chat where people could reach out to if in the future they wanted to maybe coordinate something like this for their facility or workforce, that would be tremendous.
So I want to post two different things. So the first number that I just posted, this is the vaccine helpline. And so this runs from 9 a.m. to 6:30 p.m. And anybody in the state could call this number. And so this is, I have a question about the vaccine. I have a question about where to get the vaccine. I have a medical question. I have, everything. And so questions from this get sorted into, folks who can help you sign up, doctors who can help you figure out your medical question, other things like that. Sometimes we can't give direct medical advice. So, if you have a medical problem that you have to talk to your doctor for, we'll say, please do call your doctor. But if you have a general question like, I have, muscular dystrophy, can I still get a vaccine? And then we can say, yes, you can still get a vaccine. So that's something that anybody can call for just that quick help, is the vaccine helpline. And then I'll put an email in the chat just as soon as I dig it up of the main contact person to have somebody come and talk to your group.
Great. Thank you so much, Dr. Ohlsen. And then Heather, I see you raised your hand, so go ahead.
Yeah, thank you. So I have a question about recently, I guess, lifted mandate about masks for children age 6 and up. I know that the CDC at one point had a recommendation for children as young as 2 and up, which I don't know, most 2-year-olds are not going to keep a mask on. But I was just wondering, in our center, we're strongly considering just keeping that. A large part of the reason why we're here tonight is because we're just trying to finalize that last bit of our mitigation plan. Even though we're not required by licensing to have it anymore, I don't feel comfortable getting rid of it yet. So the big thing is the masks. And of course, parents will come in and say, well, I've been quarantined, how come I have to wear a mask? So we're just trying to keep things across the board, so we don't have to have somebody monitoring someone's vaccination status. But my question is there a reason why age 6 was a cutoff? Is that because that is a health benefit, or is that because they're more likely to actually wear it? Or what was does anyone know the logic behind that age cutoff?
Another really good question.
So one thing that I can speak to is the CDC recommendation. So the CDC's never had a mask mandate, but they have had a recommendation that people age 2 and older wear masks. That is still in effect for anybody who's on public transit, anybody who's in a healthcare system setting, and anybody who hasn't had a vaccine yet. So for all kids aged 2 through 12 who haven't had a vaccine, plus anybody 12 and older who's not fully vaccinated yet, the CDC recommendation is still that everybody 2 and up wear a mask. So I would recommend that that folks who are kids who are age 2 and kids who are older wear masks. A lot of businesses are going through this right now. Should we try and figure out people's vaccination status and only have unvaccinated people mask? Or should we go ahead and require masks for everybody and not have to ask those questions? There are many, many, many places that are going with option A, including a lot of school districts. It ends up just being really challenging to have those conversations. And so for that reason, that's why people are telling me that they're saying, you know, that's fine. I think the CDC guidance is great for social activities when you know everybody well. You know, you can have that conversation with your friends. Hey, are you fully vaccinated yet? No, I have a week left. Okay, so we'll wear masks this week, but not next week. Like that's the sort of conversation that, you know, some folks are comfortable having in a social situation, but don't want to have with all of their employees. And that's a reasonable approach, if that's your approach. I don't know too much of the ins and outs of the state policy with regard to daycare, so I'm not sure I can speak to that.
I can just add, and Heather, I have a clarifying question too, that there's, for those of you outside of the municipality of Anchorage, you know, there's no licensing mandate or emergency order or changes to the licensing requirements and regulations other than, you know, what's already the childcare licensing requirements. But in the municipality, they have had a series of municipal emergency orders, you know, throughout the pandemic. So Heather, I have not, you know, I'm not an expert in the muni orders that have been coming out. Was that an age limit that was in the most recent municipal order?
No, it was not most recent. It was the one that was most recently repealed. It was like 13.5 or something. And so it was required for ages 6 and up. And then now it's not a mandate anymore. So, but we haven't officially, you know, taken a stance yet, but we're strongly leaning toward just keeping that in place. And so I was just curious if there is, I know that the recommendation was for age 2 and up, but yeah, as far as what the requirement was. So I was just curious if anybody knew why that cutoff was made, but that was also several months ago. So who knows?
You know, I don't have that information, but we can certainly help connect you to, you know, muni licensing if you want. We can assist with that. So let us know.
Great, thank you for your question, Heather. And if anyone else knows, feel free to chime in. There's kind of a wealth of knowledge here. I feel like lots of people know a lot of stuff here. Are there any other questions? How's everyone feeling about this education session? Do you feel like you're more prepared to answer questions or at least guide people in the right direction to get the help that they need to make the right choice for themselves? Because I feel like that's the point. And I think Dr. Ohlsen has given us some really great resources to move forward with. And like she said, if you have questions, she's dropped those numbers in the chat and she's given information. So if you would like to have a physician like Dr. Ohlsen come to your facility or, you know, virtually, I suppose, use that phone number or that contact for Cassie at Blueprint AK, I believe, and they can get you started or set in the right direction. So any other questions? Oh, and she just dropped, Dr. Ohlsen just dropped COVID questions at alaska.gov. So again, tons of question resources and opportunities to connect people to what they need to make good choices. So very empowering. Thank you so much for being here again, Dr. Ohlsen. This is a lovely presentation. And if there aren't any other questions, I'm gonna give a couple seconds here. We're gonna wait. I know it's hard to wait, so I'll just talk for those couple seconds. Oh, good. Well, thank you everyone again for joining us this evening. This was really, as I said, empowering. We really appreciate your time, Dr. Ohlsen, and your expertise and your knowledge, and taking your time and expertise and knowledge to help us. So thank you so much. If you have any other questions about, looks like we've dropped a Google Doc in there. That's probably the slides for tonight's presentation. But if you have any other questions or concerns, feel free to reach out. We're here for you. And thank you so much. Keep up the great work. We love you. Take care.
Thanks, Olivia. Thanks, Dr. Ohlsen. Yes, that Google link is important to receive credit for tonight. That is the evaluation component for the evening. Vanessa, is there more you want to add?
I will stay around if anybody needs any support on the evaluation, but the link is there. You can do it now, or you can do it later this evening or tomorrow. But we do encourage you to fill that out because we use it to support our future trainings as well.
Thank you all. And as a reminder, we will have this recording posted on our website, hopefully tomorrow, if not early next week. And we have also been compiling all of the great resources that Dr. Ohlsen's been providing in the chat. So we will have that compiled on our website for you as well. Thank you all again.